In the future, I see, and therefore I hope, that medical termination of pregnancy becomes more and more normalised within the umbrella of women's health care by general practice. And I think that law reform has done a lot to help drive this. Doctors are no longer confused or afraid of the ambiguity of the legal setting. So I hope that more GPs take this up. I also hope that nurses are able to provide this service in the appropriate settings. And of course, as I've said before, I feel that this is very strongly a point that public hospitals and gynaecology departments should take up. We have a responsibility to our public patients who can't afford private access to offer free, on-demand, good access termination through medical and surgical means. But I suppose, to flip the coin to the other side, ideally, my passion would be that women no longer need abortion so much in Australia, and that would be achieved by better contraceptive access to all Australian women. And I'm talking about the long-acting reversible contraceptives. If we have better contraceptives use and uptake in Australia, we'll have fewer unplanned pregnancies, therefore we'll have less need for medical and surgical termination. We're a long way behind other Western countries. We have a high unplanned pregnancy rate, a low uptake of the better forms of contraception, and therefore a higher abortion rate.
I'd like to see the future for STOP in that it continues to be performed at specialist centres who are, highly specialised and focused on providing that service. I think that does really enable the patient to receive their best experience. Of course, with the legislation all changing 2 years ago, hopefully this can be facilitated through public access. And certainly in the UK and in some parts of Australia, the public system is commissioning services with the private sector. And this is certainly something I think we should see encouraged and to continue more. At the present time, within Queensland, it's a bit of a lottery into which health service district that you reside as to whether that district will fund your procedure or not. I'd like to see that as a unilateral agreement with all health service districts that upon receiving their referral can choose either to treat the patient themselves or all have that ability to directly refer the patient and fund the patient to have the surgical termination at a specialist centre, such as Marie Stopes or other providers.
My hopes for the future of abortion provision more widely is that we continue to normalise this, that we have what are called communities of practice. So we have GPs who support each other with information and discussion around best practice, that we have conversations and pathways with our gynaecology colleagues in the hospital setting, and that we just include it as part of normal healthcare. And that does mean, strong support from the public system for those who can't afford to access abortion privately. So I think it is important that we go forward, I guess, together. I think we also should be continuing to look at new ways of doing things. So telehealth is one of those new ways that we may be able to increase provision, but there may be other things that come up that allow greater flexibility, and particularly for women who are outside the more populated areas, that flexibility in thinking continues.